Hi, my name is King Yuzing. For my course project, I had did Administrator/eMar. Administrators is about the 5 rights, which is right patient, right time, right dose, right drug, and at the right route. So this process basically has to verify and then verify it again to make sure all the process is correct. So you can see here, you got the patient's name on the top left corner, and then you get patient ID and then the physician name, and then you get the patient information, demographic, billing, insurance, and order. You can click on any of these to see what's in it. So we're gonna click on demographic. Once you enter the demographic, you see date of birth, the address, social security, employment information, emergency contact, gender, race, what is their main information that we could contact them. So this patient ID is going to be sent into the allergies and drugs and other things to verify that it's the right patient. So if a nurse scanned the waistband of this patient, it came out with the ID that matches the one that on the system, it will show that what she or he is allergic to. So for my patient, she's allergic to peanuts, shellfish. For drugs, she's allergic to Tylenol. So the nurse would know that not to give her any of those or anything contained with those, especially when during lunch or dinner time that the hospital will be providing her lunch. So once nurse verify all these, the nurse will click back on the nurse dashboard to go back and verify that it's the right person again, and then they can hit continue on the bottom left to continue to this nurse dashboard, which has the patient information. For the patient information, you could order imaging, you could order drugs, you could order medication, order labs, medical histories, smart pump BCMA. Medical history has the patient's previous hospital visits or previous hospital stay, or maybe admit to hospital and then left right away. It has her before her visit that were her medications on it too. The smart pump is something that is a system where if this patient were taking 2 medications at the same time, we wanted to make sure that he or she is taking the correct one at the right time and the right amount or right doses for it. So smart pump will sit there and recognize it, says, oh, if your patient is not taking the right time, or maybe 2 medications interact with each other, that they cannot be able to take the medication. Once you click on the order type you need, we just pick the order type for drugs. So for my patient, she suffered from minor migraines or headaches. So the physician prescribed for it is a pill. You take it by mouth, and it's twice a day, or doesn't matter, or whenever she needed to. And once the physician ordered this, the physician can approve it by checking this, sign and send it off, or he or she can cancel it, where there's something wrong that interact with her other previous medication, so they have to cancel it and find another alternative. Once he had ordered the prescription, the physician has ordered the prescription, he gonna order. The nurse can view under orders and look under recent orders, and you'll see that what the order ID was, who was it ordered by, when, and what time. And then the nurse can send, and then it go through, send it to the clinicians, and then the recommended drug dose will recommend how many pills you need to take, or how many pills they need to prescribe her with. And they'll go back to verifying her patient ID to make sure it's the right person taking the right drug, and the information given to her is the correct one. Once you verify the orders, it will shows under her patient information. Here's a small box right here. You could check it or uncheck. Checking it, you could either delete. You could also the nurse could remind her about the rules repository, or you can save it. Or if everything's correct, you can just check it and save it, and then it will send through the process, and everything will be going back to the clinicians, administrator to double verify to make sure everything is correct. Once they done everything, so the nurse board will have able to go back to their nurse board, and then on their patient information, it will have everything what they needed. Now, at this moment, they just need to tell the patient, this is what you've been prescribed, this is how many times you need to take, this is how many pills you need to take, or you could take before or after a meal. And once they're done with this patient, they can save all their works and then move on to a different patient. On the bottom left corner, it says new patient. You can click on it, you can add a new patient information, or you could click on doctor's order to verify that nothing's been missed on the previous patient, and then to confirm it again. Once everything's completed, the nurse decides that everything's completed for this patient, the nurse could click log off and everything will be saved the way it was before. So next time, if she was admitted again to the hospital, there's something in the system to remind you that, oh, she's allergic to this, she's been taking this, so the nurse will take into consideration and the doctors to know what to do next for her. Thank you.